Okay, so just gonna run through the basics real quick, and then we're gonna get you guys hands on the probe so you guys can get some practice, okay? So first question is, how does ultrasound work? We're gonna talk a little bit about this, just some of the basics of how it works, the physics, just so that you guys can know how to optimize your image, all right? So ultrasound beams are produced and received through what's called a transducer. Here's a picture of a transducer there on the side. So what happens is the transducer gets electricity. The electricity then helps these little tiny crystals vibrate, right? So that turns electrical energy into mechanical energy. As those crystals vibrate, it produces sound waves, okay? And then those sound waves are put out through the end of the transducer and they go into the tissue, okay? The name of these crystals are called piezoelectric crystals, or it creates what's called a piezoelectric effect, all right? So those sound waves are going out the end of your transducer there, okay? Then they interact with the various levels of tissue that you're scanning, that you're looking at, okay? And as you can see, some of those sound waves come back to your transducer, which is good. That's going to help you make the image, right? Some of them go through that initial tissue and go to deeper tissues, right? And then some of the ultrasound waves are absorbed into the tissue as well. All right, so that transducer gives out the sound waves, and then based upon the strength of the sound waves and how quickly they're coming back, it produces an image, or the ultrasound image, on your machine or on your screen, okay? So let's learn a little bit about the language, or the basics of the language of ultrasound, all right? So we use the word echoic, right? You can think of echo, right? It's sound waves, so they echo, right? So echoic means how white something is. So if something is hyperechoic, right, it means it's whiter or kind of a lighter gray. And then hypoechoic means it's a darker gray. And if there's no white in there, so it's completely black, we say it's anechoic, right? There's like no echo coming back from that, okay? And then we can say something is isoechoic. So when we're comparing two things, like this structure is isoechoic to this other structure, that means they have the same echogenicity, all right? And then most of the time when we're comparing something, saying, hey, this is hyperechoic or this is hypoechoic, in MSK ultrasound, we're comparing it to the subcutaneous fat level, okay? So that's kind of the relationship with those terminologies, all right? So you're gonna get a lot of practice seeing these different structures. I'm not gonna go through each of these. You're gonna hear more about these during different lectures, but this just gives you a reference of what some of the structures are gonna look like, some of the MSK structures are gonna look like, and how, what terminology we would use for those, right? So how does this apply to pediatrics? Well, you know, kids are a little bit different than adults, right? So it's important when you're scanning the kids that you wanna set proper expectations so that you can get better cooperation from the kids. And that leads to what? Better images, right? So you can make better diagnoses or do better treatment for these kids. All right. So their biggest question is usually, is it going to hurt, right? When I'm going to the doctor, am I getting a shot, right? Right. Is this going to hurt? No, it's not going to hurt, right? That's we tell kids, hey, we do this on babies, right? Before they're born. That's how you know it doesn't hurt at all. Use words that they understand, right? I say, okay, here's a camera. We're going to put it on your skin and it's going to make a picture. We're going to see what's inside of you. This is really cool, right? And then another big thing for kids is if you can get a gel warmer. A lot of the machines have built-in gel warmers, but some do not. And so, you know, put that cold gel, they're like, oh, they kind of freeze up. They're already maybe a little uncomfortable. So warm up that gel. That'll help out a little bit. And then keep them engaged. Show them that the images on the screen can be helpful. All right. So we're going to show you just a little bit about some of the machines you're going to be working with today. So first question, what transducer are you going to use? So for MSK, these are kind of the three basic transducers that are usually used. The one on the left, it's a high frequency linear probe. All right, the one on the right, we call it the hockey stick probe, but it's also a high frequency linear probe. And you can see it's very short. It's called what we call a small footprint. All right, so around really knobby areas, you can kind of scan around and get in those little crevices that are sometimes there on kids. And then this other one is called a curvilinear probe. It's a low frequency probe. So for pediatric MSK, we're usually using the high frequency probes, whether it's your standard linear one or the hockey stick one. And these are general guidelines of my probe selections that I use. You can see for some of the bigger joints, bigger spaces, I'm going to use that standard linear probe. And then if I'm like around the foot, ankle, or you don't have as much space to work with, I want that smaller footprint there, okay? All right, so I remember when I was in medical school, people talking about ultrasound and be like, oh, left side of the screen means medial or proximal. And I just could not like wrap my head around that. It took me a long time. That's what they standardly do in radiology because sonographers will often take pictures and that lets the radiologist know that, hey, this is the screen orientation, all right? But you don't have to follow those rules, okay? So if you look at this screen here, you see these two probes, you see that little fin or that little notch there, okay? That correlates with the left side of your screen, okay? And each different machine from different companies will have, they usually have some little mark or some little dot or something like that that can help you correlate that side of the probe with the left side of the screen, okay? So let's practice this, all right? So here we're holding a probe over the ankle. You see the arrow there pointing to the notch, okay? So look at the ultrasound image. The left side of the screen is what orientation on the patient? It's going to be proximal, right? If I had had that probe flipped around, right, then it would be distal, right? All right, so the left side of the screen is proximal. All right, now look, I flipped my probe. All right, so look at the probe. You can see that's the lateral ankle, the lateral side ankle we're looking at. Do you see the notch there? No, that's not the notch, right? The notch is kind of something that was sticking out. So the left side of the screen is going to be medial, right? If I had flipped my probe around 180 degrees, then the left side of the screen would be lateral, okay? So just pay attention to your notch, and that will help you to be able to orientate yourself with the screen, okay? You don't have to follow those rules, right? And sometimes for me, it makes sense not to follow those rules when I'm looking at something. Like, yeah, it makes sense in my brain that I have the probe this way as opposed to the other way, okay? The second thing is what we call anchoring. So how do you hold the probe? So if you look at this picture here, there are maybe 2.5 fingers on the probe, and then at least 2 fingers on the patient, right? You have this probe, this transducer, and you have gel, right? Which is like a lubricant, right? So it can get really slippery. So we use the word anchoring because you really want to anchor down on that patient to make sure that you're not slipping and sliding all the way. So here's 2 examples. Left side of the screen, good example of anchoring or bad? Seems like got a couple fingers down there, so that's a good example of anchoring. What about the right side of the screen? Yeah, we slipping and sliding all over the place. You're not going to be able to maintain the image that you have there. All right. We're talking just a little bit about physics just to help you understand and make your image better, okay? So the ultrasound sound waves are going to interact with tissue in 4 ways, right? They're going to reflect, which works in your favor, right? These waves can also just refract and go at a different angle through deeper tissue. They can scatter, which that's not going to help with your image very much, and then they can get absorbed into tissue, okay? Now you're looking at a 2-dimensional image on the screen, but remember patients are 3-dimensional, right? And technically the ultrasound does look at 3 dimensions, but you have to think that what we call the slice thickness is about the thickness of a credit card. So what that means for you guys, or means for all of us, is if the image you're looking for, the structure you're looking for, is not within the width of a credit card, and a credit card width of your probe, then you're not going to see it on your screen, okay? You'll get some practice with this today, okay? Another important principle is the importance of angle incidence, right? So you can see those angles going down. Those sound waves are going to reflect, but they're not going to come back to your transducer, right? And if they're not coming back to your transducer, you're not going to get the image created that you want, okay? Sometimes, but not all the structures we're looking at are flat, right? If they're curved, they're going in different angles, all right? So what you're going to learn is you're going to learn how to maneuver or how to move your hand and move your probe to make a really good image, all right? This is what separates good images from bad images, is learning these basic moves, okay? Today, you're gonna be like, I know, I should see this structure. And then the faculty is gonna come and move your hand just slightly, and it's gonna make the image so much better. You're like, how did you do that, right? But you're gonna learn that it's just these simple movements that it's gonna make your image so much better, all right? So the first one is sliding, right? So just subtle, you can kind of slide side to side, you can slide up and down, all right? The other one we call rocking, or it's heel to toeing, right? So you can see how that just slightly changes the angle of incidence just a little bit to try to get more of those sound waves coming back to your transducer. The next one we call rotating. So kind of rotating back and forth there. And then the other one is tilting, right? So tilting back and forth, or also called fanning there. So these are things you guys are practiced, but you get these down, these are going to help you to be able to really sharpen your images. All right, just a couple settings on the machine to know. A lot of machines have preset settings already. That can be helpful. But you can customize these settings, and you can adjust them as you kind of learn and go along the way. All right. So this is just one example of one of the machines that we're using. Of course, there's the power button there. You want to select the appropriate probe or transducer that you want to do, which will be touch screens on all the machines that we're using. And then there's a freeze button if you just want a still image to point some structures out. And then the next one is the depth button. So depth is what makes sense, right? How deep your structure you want it, or how deep you want to look, right? You want to set your depth only as deep as the structure you're looking at. So if you look at the example here, we're looking at the quad tendon over here with the femur down below. You can see on the left screen, it's down to 3 centimeters. On that right screen, it's down to 6 centimeters. There's a lot of empty space. We're losing a lot of the detail because our depth is too much there, okay? Another one is frequency. Not to get too much into frequency or too much into the physics of it, but the higher frequency, the better resolution. So you want to try to use the highest frequency that you can. But the higher frequency, the more those sound waves get attenuated. So the more that you're not going to get as much depth on it, okay? So that depth is really going to suffer there. So to see really deep structures, you're going to want to use a lower frequency probe. Most of the time in pediatrics, though, we can get away with high frequency settings and high frequency probes, okay? So superficial structures, higher frequency, deep structures, lower frequency, all right? You say like deep, low, or something. I don't know how you want to remember that. So here's an example of frequency. There you got 12 megahertz on the left, 9 on the right. You look closely, things are just a little bit fuzzier on that right side. You get just a little bit more detail of that quad tendon on the left side there, okay? The next thing is the idea of focal zones, and that makes sense, kind of makes sense on itself, like focal zones. If there's an area you want to focus on, that can help improve the resolution or how good your image looks here, okay? So you can change the focal zone, and you'll see these little yellow markings on the side. The touchscreen machines have automatic focal zones, but the bigger machines, you'll be able to practice adjusting that focal zone. So what focal zone does is the machine actually bends those ultrasound waves to a certain zone, a certain area. And you can see if you look at these dots, if you have more ultrasound waves going in that specific area, that specific depth or zone, there's going to be more waves coming back, which is going to improve the resolution of your image there, okay? Gain is brightness, right? So people have different preferences on brightness there. So you can see just an example of this, the same quad tendon going down just with increasing gain there. Obviously, overgain it, everything's going to be bright. You won't be able to distinguish between different structures there. There are some settings where you can actually change the gain based upon the depth there, but you'll learn how to play with those as you grow in your ultrasound experience. All right, wrapping up here. So Doppler. Right, so what is Doppler? So Doppler actually sees the movement of red blood cells. So red blood cells emit a certain wave frequency, and the ultrasound waves can pick up on that, okay? And so what that means is for MSK structures, we can see, right, blood flowing to the area, right? For rheumatology patients, right, these teeny tiny little microvessels or increased inflammation with increased blood flow there, you can actually pick that up with a Doppler signal, all right? And this is an example of Doppler. You'll see this little box coming up, and When things light up there, that tells me that there's some flow in that area, okay? So you'll get to practice a little bit with that as well. Just a couple of other settings. You may not want to, a lot of these are just automatic these days, but dynamic range, that tells you kind of the shades of gray. So if you want a softer image versus a more starker image, you can adjust the dynamic range a little bit. Compound spatial imaging helps steer the direction of the returning echoes to try to get more coming back to you and kind of cancel out some of the noise, which just improves your image as well. And then when sound waves hit tissues, it actually produces their own waves. So tissue harmonics can help filter out some of those other waves that come from the tissue as the sound waves hit them, which just improves your image as well. All right. So just a couple of tips for the beginners out there, right? Like, man, I want my image to look better. Why can't I look at the image? Remember those movements, those subtle movements. That's going to be key, right? If you know your anatomy and you know those subtle movements, you'll be able to get those, get really good images, right? And then you can also check your settings to make sure that your settings are appropriate, proper depth, gain, frequency, right? And then what if you're having trouble maintaining your image? Like, I got it, but then I lost it, but then I got it, but then I lost it, right? Remember, anchor, right? Anchor properly. So your hands are going to get, right, they're going to get a bunch of gel on it. It's going to get messy. That's normal, all right? Remember, it's just gel. It's made of water, okay? But if they're not messy, you're not doing it right, all right? Questions on any of these things? Very good. Okay, so it'll be our first scanning session. Just learning the basics, learning the machines a little bit. Okay, so if you look on the back of your badge, that tells you what station to go to. Midway through, you'll see there's a timer on a TV screen over there. Midway through, I'll announce, and everyone's going to switch with the station above or below them so that you guys can get experience on both machines we'll be using for the next 2 days. Okay, so go ahead, you guys can make your way over to the machines, over to your stations.